Subscribe to our YouTube channel and press the bell icon to never miss a video from Radio 1.
Here we go. This is 94.3 Radio 1, One World, your station. You're with me, Erica, and joining me today, is a very, very special guest, Dr. Shane Creado. He's a sleep doctor, a sports psychiatrist, and an author, and he practices functional sleep medicine, integrative psychiatry, and sports psychiatry. Welcome, welcome. I've been so meaning to talk to you.
Thank you, Erica. I'm so happy to be here and share some helpful strategies for our audience today.
So I've been wanting to chat with a sleep doctor for a while now. My sleep cycle has been broken. And I think the more people I've been talking to, I just find that, my situation kind of resonates with them. So I'm going to get into that. But first, a little bit about your backstory, Dr. Shane. We'd love to know how you got involved in this field.
Absolutely. So I started off doing physical therapy, actually, and then went to med school. And in medicine, I really moved towards psychiatry. I really like getting to know people's stories. And when I trained in psychiatry in the US, in Wisconsin, in Madison, Wisconsin, there were a lot of people, if not all of our patients, having sleep issues with psychiatric issues. And it was really not addressed properly, Erica. People were throwing meds at them rather than looking at the underlying factors. So I started doing my own research. And I found huge overlaps between depression and sleep apnea, anxiety and PTSD and insomnia. And the more I learned, the more I found that you needed to treat sleep individually, not together along with psychiatry and hoping that something would work. So I trained in sleep medicine after psychiatry, and then I got into sports psychiatry. And now I work with the International Society for Sports Psychiatry, the US Olympic Committee, the NBA Players Association as well, at the interface of brain health, mental health, sleep, and performance optimization. So I'm delighted to do this because it's not just about normalizing, but optimizing people's lives.
Right. So my Fitbit, I can't even remember what device it was, a few years back showed that I was having little or no sleep. And that came as a surprise to me, but it also explained my grumpy mornings. And yet I didn't kind of want to acknowledge that I had some kind of a sleeping disorder. So how does one realize that one has a sleeping disorder? What are the kind of everyday signs we should be looking out for?
Right. Well, according to studies, around 93% of Indians are sleep deprived. So pretty much everybody is sleep deprived. I know it's really shocking to find the statistics, and we think we can survive on little sleep, but the fact is we're going to pay the price in the long term. Some of the most common symptoms are obviously waking up unrefreshed or feeling sleepy during the day or having really restless sleep, or your spouse telling you that you're snoring and they want to suffocate you with their pillow at night, or tossing and turning in bed, right? Some people sleep talk or sleepwalk or act out their dreams and unintentionally, of course, may hit their partner. So all those are clues that there's something going wrong with someone's sleep. However, there are other issues that also manifest if someone is sleep deprived. You might be irritable, as you were saying. You might be really, concentration might be a big issue for you. You might have trouble recalling information or learning new things. Huge overlaps with anxiety, depression, low motivation. If you think of jet lag, that's basically how you feel if you're sleep deprived. So it might be the amount of sleep that's a problem. It might be the quality of sleep. And as you were mentioning a Fitbit, you might have thought that you were getting enough sleep, but is it the right quality? Is it the deep sleep and the dream sleep? And also the timing of sleep is crucial, what we call the circadian rhythm when we want to sound really fancy in medicine.
Right. Well, thanks so much. That's a lot to sort of take in. Are there different kinds of sleep disorders? What about people who like to sleep too much and people who sleep at the drop of a hat anywhere, anytime? And I'm so jealous of those people. Is there a golden rule for kind of optimal sleep time that will help our body reboot and recover?
Yes, now be careful what you wish for, Erica, because people who sleep all over the place might have narcolepsy, and that's not
Ah,
a fun disorder. So there's, of course, people who are not getting enough sleep. They have difficulty falling asleep or staying asleep or waking up too early. Those are the insomnias. The excessive
right.
sleepiness, like narcolepsy, is another big issue because if you're getting or needing more than 10 or 11 hours of sleep in a 24-hour period, it might be a manifestation of something more serious.
Right.
There's also the sleep breathing disorders like sleep apnea that's now the rage all over the world, where the airway kind of collapses and you can't get enough oxygen into your system.
Hmm.
Then there's a sleepwalking, talking, or what we call parasomnias, sleep movement disorders like restless leg syndrome. And then the circadian rhythm disorders. Some of us may be night owls or morning birds, but our lifestyles are not always consistent with our biology, right? And then we have to shift those rhythms in order to be functional and perform well during the day.
Right. So, it all boils down to when they say sleeping like a baby. You literally have to sort of take it back and figure out how one can sleep like a baby. So, speaking of home remedies, in India, we love our home remedies. Um, do you have any simple enough home remedies that you can share that will help me get a good night's sleep?
You bet. So, as you rightly said, it's about going back to the biology. Babies sleep a lot, and the older you get, the less sleep your body needs. So, we always need to remember three things: the timing, the quantity, the quality. And I think about optimal sleep not in terms of hours, but in terms of sleep cycles. So, if you think about 90-minute sleep cycles, 90, most adults may need 5 sleep cycles in a 24-hour period or 7.5 hours of sleep. My athletes who train really hard may need more sleep than the average person. So, simple strategies are not fancy medicines or expensive gadgets. It's going back to the basics. Having a fixed wake up time every day or most days of the week is going to anchor your sleep and the rest of your day. And then you count backwards to say you want to wake up at 7 in the morning every day, then you know that you should be able to be sleeping by 11:30 p.m. So 1 hour before that, Erica, maybe 10:30 p.m., you need to start a nice calming, winding down routine before bed. Maybe writing down your to-do list, maybe your worry list, meditation or breathing. Big meditation is big in India. Obviously, that's where it originated. Yoga is particularly beneficial to relaxing the mind and promoting good sleep. Also, remember no vigorous exercise at least 3 hours before bedtime, or no big meals before bedtime, alcohol before bedtime, caffeine, nicotine are stimulants. So, those are some simple strategies to allow you to get into normal rhythms. I always tell my patients, wear dark glasses at home or dim the lights, pretend you're Bono from U2, it doesn't matter because that's going to allow your natural melatonin levels to rise before going to bed at night.
Right, right. Yep. Put your shades on because, you're so cool, the sun always shines.
I love it.
Okay. Getting a little technical next. The biochemical reactions to being sleep deprived. Oftentimes, we don't even pay heed to it. We don't even realize what's going on in our body biochemically. And what are the resulting effects on you, on your physical, your mental, and importantly, your social well being?
Now, this is where things get scary, Erica, because the long-term consequences of sleep deprivation are devastating. If we think about the most common causes of death in the world, we think about heart attacks, strokes, dementia, cancers, traffic accidents. All of those are directly related to sleep deprivation in the population. So, yeah, sleep deprivation actually kills. Sleep deprivation also affects your hormone balance. So, guys who get less than 5 or 6 hours of sleep every night have testosterone levels similar to guys who are 10 years older than them. Women experience early menopause because of sleep loss, increased inflammation because of sleep deprivation, and increased stress hormone production like cortisol.
Okay.
Premature aging, your DNA actually ages quicker when you are chronically sleep deprived. Over 300 genes that worsen inflammation and increase your cancer risk are activated with sleep loss. Your immune system crashes with sleep deprivation. Sleep deprivation can make you fat. 89% of kids who are sleep deprived go on to develop obesity. Heart disease, heart attacks, strokes, diabetes risk, all directly associated with sleep loss. So that's just the physical manifestations of sleep loss. In terms of mental health, sleep loss is directly associated with increased risk of anxiety, concentration problems, because the front part of your brain isn't working properly, which helps you with concentration, attention, executive functioning, task organization, planning. ADHD and depression, there's a 90% overlap between depression and insomnia. PTSD, big overlap with traumatic experiences actually are difficult to get over if you are chronically sleep deprived because those stress hormones keep circulating. You might have increased substance abuse issues or impulsivity with sleep loss. Bipolar disorder and dysregulation of your emotions is also affected with sleep loss. And going back to your social question, it's similar. Sleep loss affects your brain just the way a lot of alcohol does. Your rational brain shuts down. You can't pick up on social cues. Bad news when you wake up and you trouble your spouse in the morning, or if you have a morning meeting at work and you don't know when your boss is giving you the eye and you're talking too much or you're more impulsive. So it's going to affect your quality of life, your work, your productivity, your social circle, and your overall life expectancy. So it's devastating to your health.
Wow. All of this, just listening to you, it clearly indicates that we really haven't paid much attention to how much sleep we're getting. So imperative. Um, Everyday situations, brand new parents with their little infants, keeping them up at night, kids studying for exams, especially in India. You know how much of focus academics gets. I have to share this with you. One of the student counselors that was talking to my son literally said, look, these exams are so important. Doesn't matter if you don't get sleep in the night. Doesn't matter. These exams are so important. What do you have to say about that?
I beg to differ. I remember when I was training in psychiatry, the chief of brain surgery stood up and someone was giving a lecture on sleep deprivation and the medical dangers, the risk of serious injury and medical mistakes, surgical mistakes. The chief of brain surgery stands up and says, brain surgeons don't need sleep. And I'm just putting my face in my hand saying, no, that's terrible. So, yes, if you want your kids, if you want to improve your memory and concentration and retention of information, you need optimal sleep. The data is very clear, Erica. It shows us that students with better sleep have higher grade point averages or grades. They can retain more information. We all know that you need sleep after you've studied something in order to consolidate those memories, especially in REM sleep or dream sleep. But your brain also needs sleep prior to learning. Otherwise, it's like a waterlogged sponge. Nothing can get in. Your memory inbox is full. And they've done studies on this. They found that the activity in your memory centers, the hippocampus, reduces by 40% with sleep loss. That's
Wow.
the difference between failing and getting an A. So yeah, I do beg to differ because the right kind of sleep is going to enable you to study well, study quicker, study smarter, retain that information, and then recall that information much better than you would otherwise.
Yeah, well, a very old saying by a very wise man: early to bed, early to rise makes a man healthy, wealthy, and wise.
Touche.
Okay, now in the age of devices, devices are devious, Sleep snatchers, do you agree with that? And how do you get these gamers and these young adults to kind of choose sleep over gaming or binging on, the latest series, or like Euphoria, for example? They're binge watching that. How do you control that and tell them, hey man, clock off a little bit, you need to get some sleep?
Right. Well, it doesn't always work when parents tell teenagers that, right?
True that, true that.
Teenagers are a vulnerable population because they're trying to be adults. They haven't quite figured it out yet. They're dependent on the parents' roof and finances in many, many cases. So the way I work with teenagers is catering to their needs. And I'm a straight shooter. It's not lying to them or trying to take away their devices. It's just not going to work. It's only going to cause you to lose your sleep because then you have a fight with them at home. So what do teenagers want? What do young people want? They want to perform well in studies, in sport. They want to be popular. They want to grow taller. They want to get good grades. So the fact is, when you advise them, when I've advised them on how putting away their devices, getting the right amount of sleep can actually boost their growth hormone levels and testosterone levels in deeper stages of sleep. When it lowers social anxiety, so you can ask that person you've always wanted to ask out on a date sometime. When you know that you're going to be able to retain information, perform better in studies, and your sports performance will improve. That's my bread and butter, right? That's what I do with my elite athletes. How do you boost their reaction times, your peak performance, muscle mass? Teenagers, especially females, want to make sure they're healthy weight. So when you tell them that sleep deprivation can actually make you hungrier, for every 4 hours of sleep you lose, Erica, your brain thinks you need 900 more calories to eat.
Really? Wow.
Yes. And you're going to
Wow.
resort to junk, right? And stress hormones cause fat accumulation in us. So everything you eat then gets converted to fat. And less testosterone, less progesterone, more emotionality, more stress eating. So when teenagers know that this is what can happen, they will follow advice to improve their quality of life and fulfill their goals of being attractive, being taller, being healthier weights, and performing better in academics and sport. And those devices are really devastating, Erica, not just because of the blue light,
Hmm.
but also we're obviously not doing something boring on our phones at night. It's obviously something exciting.
Yeah.
And exciting things, whether you're swiping on Tinder and getting the dopamine hit all the time, to to the gamers, it's all a dopamine hit. It's kind of like slot machines and gambling, hit
Right.
after hit after, and that's going to keep you up at night. It's going to really affect your ability to get the sleep that you need.
Right. Wow. Okay. Makes a lot of things clearer now. And I'm going to try that hook. I'm going to replay this to my son, and fingers crossed it will work. Okay. Hacks for a good night's sleep. How important is having the right mattress, the right, investing in the right bed linen, all of that, all those things, aromatherapy, music therapy. Give us some hacks for a good night's sleep.
Oh, there are plenty. The most important thing is consistency, having a fixed wake up time every day and structuring your waking hours as well. Like fixed meal times and fixed exercise times go a long way in setting your day up, but also setting your sleep up. And when you have a fixed wake up time, don't immediately go to your phone. Don't immediately start going to your work emails because early in the morning, Erica, our stress hormone levels are naturally peaking. But if you then do something activating, it's going to make them go through the roof and you'll start the day in panic with more anxiety. So avoid anything stressful for the first hour of the day. No news, no politics, no work, just relaxing and doing something gradual as you're getting into your routine during the day. And in the middle of the night, if you wake up, don't look at the clock. Please don't look at the clock or your watch because you're going to say, oh no, I don't know when I'm going to fall asleep again. And then you'll start looking at the clock and it's going to activate your brain some more. So avoid clock watching. And in the middle of the night, if you feel you've not been able to fall asleep for 20 minutes or so, stop trying because trying is a surefire way to activate your brain.
Right.
Don't start looking at emails or doing any chores. Get out of bed, do something boring, do some breathing exercises, like the 3-3-6 breathing rule, which I love. In through the nose for 3, hold for 3 seconds,
Right.
and out for 6 seconds through the mouth. Relaxes the nervous system. So, those are a few quick strategies. Calming before bed, not staying in bed, tossing and turning and miserable too long, because then you associate the bed with wakefulness and worry. Only using the bed for intimate time and sleep, not for devices, not for reading,
Right.
not for anything else. I want your bed to be your cave, your bedroom to be your cave. No stimulation at all. It's not an extension of your living room as much as you like it to be.
Sleep like a caveman.
I love that. That's so true. Did caves have flat screen TVs? No. Did caves have cell phones or EMF? No, they didn't. Caves are non-stimulating, right? Black walls. There was a fire outside, maybe to keep the animals away.
Yeah.
And the great thing, Erica, is that fires have red and orange light, which really don't affect your melatonin. So you can have the red and orange light, candlelight. Maybe make it a romantic evening every time with your spouse at night.
Yeah. Every time? Okay. Moving along. Okay. This is important. You snooze, you lose. That's been ingrained in our highly competitive work environment. Should offices have nap rooms?
Oh, yes. I'm a big fan of nap rooms, and part of my work is working with organizations in helping their employees get sleep. And of course, organizations say, oh, you're going to snooze. What about productivity? But when you show them the data, Erica, when you show them the studies that show that your productivity, your work performance can improve with better sleep,
Yeah.
then they will buy into it because all companies want to improve their bottom line. And nap rooms are being used in many companies now. There's Huffington Post, even Pizza Hut, Zappos. There's tons of companies that are not having nap rooms in their headquarters, and it's showing to be great benefit to their employees. But you also need to know how to nap. And when it comes to strategic napping, there's timing, there's duration. And ideally, a 25-minute to 30-minute nap is what's important. If you get too much, you're going to wake up out of a deeper stage of sleep and you're going to be really drowsy and groggy after you wake up.
Okay.
So there's so many studies, Erica, to show that good sleep, strategic napping can boost your performance, productivity. There was a NASA study that showed that you could just a 26-minute nap could increase alertness by 54% and performance by 34%. And we know that some of the greatest people in history, Nikola Tesla, Leonardo da Vinci, Lyndon B. Johnson, Arianna Huffington, Marissa Mayer of Google, Charles Dickens, Winston Churchill, all were famous nappers.
Okay. Well, that's fantastic. I'm going to play this out to my boss very soon. Uh, right. Now, this is important. Nutrition and sleep. Are there any particular foods that inhibit sleep and other particular foods that will enhance our quality of sleep?
Definitely. So there are lots of good ways to eat healthy to promote sleep. Now, during the day, if you want to stay alert, the best is to avoid sugars and carbohydrates or high fat foods during the day, like your breakfast or your lunch, because they're going to make you really sleepy.
Right.
So avoid the stuff like a lot of rice, pasta, pizzas, sugar, candy, chocolate during the day. Sleep promoting foods need to have tryptophan, which is needed by your body to make serotonin. And those may be milk, turkey, chicken, fish, eggs, pumpkin, beans, cheese, green leafy veggies. Serotonin containing foods are helpful for sleep, like sweet potato, blueberries, chickpeas, apples. Antioxidant containing foods, very helpful. Vitamin E, vitamin C, beta carotene. So what are those kinds of foods? Well, you think about fruit, bananas, carrots, high in beta carotene, really helpful for antioxidant properties. Kiwi fruit, tart cherries, good amounts of protein, Greek yogurt, warm milk has been shown to be beneficial. Now, it's been an old wives' tale. Oh, warm milk will help you sleep better.
That's right.
It turns out there's studies that show that milk milked from cows at night has higher levels of melatonin to help you sleep better. Foods that have magnesium are really good as well. Foods that have GABA, such as oranges, spinach, bananas, really good sources of sleep promoting nutrients.
Okay. Wow. Thanks so much for that list. I'll be going shopping very soon. Um, Moving on to sleep apps, meditative apps. I've tried a few. Some worked, some not quite. But in your line of expertise, how useful have they been proven, if at all?
Practice makes perfect, Erica. So if you have a busy brain, it's going to be hard for you to fall asleep. The Dalai Lama once said that sleep is the best meditation. So, meditation is simply about a focused state of concentration and suppressing all the other environmental stimuli. So, that's why meditation may take the form of breathing or listening to a calming voice or progressive relaxation or visualization strategies. And if you practice with certain apps, find what works for you and stick with what works, that's what matters. So, a few of the sleep apps I like are Headspace, and they have sleep stories or sleep casts, which can help you drift into sleep. The Calm app, the 10% Happier app, the Breathe to Relax app are some of my favorites. And meditation doesn't just help promote sleep, but a Harvard study in 2018 showed that people in their 50s who meditated for 27 minutes a day over just 8 weeks developed as much gray matter in their front part of the brain and the sides of the brain, concentration and memory centers as 25-year-olds. So
Wow.
meditation actually promotes gray matter in your brain.
Okay. Well, that's fantastic. Um, do lullabies work? Do you have a snooze playlist? Do you have a go to sleep playlist?
It depends on whether it's good singing or bad singing, right?
Oh,
So yeah.
so like, a bit of, I don't know, sometimes I sort of go way back and, listen to a bit of REM, all those people. So do you have kind of a playlist you'd like to share with us?
Yeah, so I lullabies do work. Anything that relaxes your mind does work. Now, you're not going to want to listen to some really upbeat hip hop or techno because that's going to keep you up. Barry Goldstein is a Grammy Award winning music producer who I know very well. And he's done a lot of looking into certain music and melodies that help promote sleep. Gregorian chanting can promote sleep and relaxation. I love Gregorian chanting personally, and there's numerous Gregorian takes on modern songs, including REM's "Losing My Religion," which I love. There's binaural beats.
Yep.
Focus on
Yep.
sounds that are familiar, on songs that may take you back to a comfortable stage in life. Because Erica, sleep is the most vulnerable thing that we do.
Yep.
And when you are going into a vulnerable state like sleep, you need to feel safe. So,
Mhm.
listening to something calming, relaxing, with comfortable memories, good childhood memories, is going to be important for you. And always remember to try and sleep on your non dominant side if possible,
Uh-huh.
because that's the side in which your subconscious mind feels most relaxed. Because your dominant side is then up, and then if your psychological system is thinking, oh, what if someone has to attack me? Your dominant hand can go up to protect yourself. So psychologically, sleeping on your non-dominant side is the most comfortable sleeping position for most.
Right. Just to clarify, in terms of the dominant side, that means if you use your right hand, if you use your right side more often, that will be your dominant, I'm guessing. So it's always best to sleep then on your left.
Yes, that's
Right.
correct. If you're right-handed, sleep on your left side and vice versa.
Ah, very interesting. Um, Tell us a little bit about your book. It's called Peak Sleep Performance for Athletes, the cutting edge sleep science that'll guarantee a competitive advantage. A little bit about what goes into that book and what we can get out of it.
Absolutely. So when working with the elite athletes that I work with, I was appalled to find that no teams, no international sports organizations were focusing on sleep unless there was a major problem, Erica. But athletes don't wait for a problem or physical injury to get rehab to train physically or train mentally. They do that anyway. They focus on nutrition, mental training, physical training, but sleep was thrown to the wayside. So I felt this book needed to be written because of the overwhelming data that sleep is free, it's easily accessible, and it's one of the best performance enhancing tools you can possess. So during quarantine and the early part of last year, I said, what am I going to do with all my weekends? I decided to write this book with the best evidence based strategies. All the tools I use with my Olympic athletes are in this book for anyone to access, implement immediately, and boost their performance and productivity. Because whether you're raising your kids at home or working in a high powered job or a jet setting CEO or an elite athlete, we all want to be athletes in our own way. We always want to be the best version of ourselves that we can be. And that's what the book is for. Cutting through all the ambiguity and giving you practical skills to hack and weaponize your sleep as a performance enhancing tool.
I like that. Weaponize your sleep. Um, and finally, any kind of real life examples that you could share with us with people you've treated. If they are public figures, and how has this particular sleep therapy changed things for them? Can you give us some examples or anecdotes?
Yeah, there are tons of examples in my book. There are certain names that I can't mention, certain names I can mention. Like when we worked with Justin Bieber at the Amen Clinics, I worked with Dr. Daniel Amen. His sleep was terrible. I'm sure you remember he quit the music industry a couple of years ago.
Oh, yes, we do.
And yes, and he was going through a lot of stuff. And one of the main things that needed to be treated was his sleep because that anchors your mood. So we helped him out with his sleep, and he had Dr. Amen on his documentary Seasons on YouTube Premium. We've worked with other people. I worked with a few athletes, Kyle Korver of the Milwaukee Bucks, the NBA player. And there's some other cricketers I've worked with as well. And I was training a few athletes leading up to the Tokyo Olympics before they got scuttled. So now we have to revamp our approach and start working on that stuff again. So it's been really interesting. The NBA has shown tremendous interest. The US is way behind, but now they're getting more into it. And speaking with the chief medical officer of the Australian Football League, speaking to a few Indian cricketers who you guys will know really well. And hopefully, we're going to have a system in place, not just, oh, here's some sleep hygiene tools, but you're going on tour to this country. These are the times of your matches. Here's your training times. This is how much sleep you need. Here's the way you're traveling. Here's when you're going to travel. So here's a sleep protocol to hack your sleep. How do you bank sleep before big games? How do you strategically nap? How do you perform optimally? How do you wind down if you have a late night match? All of that stuff is so important, and the data is there. It shows, and there's more technology we're working with. And to go along with that, I'm actually developing a video series that's going to be out in March that trains doctors, nutritionists, physical therapists, mental health coaches who work with athletes and teams on athletes' sleep and how to train their athletes in sleep, because not many people are aware of this. There's a huge need in sport and the rest of the world. So that video series will allow other people who work with athletes to take these skills forward and train other teams and help other sports organizations create guidelines around this.
This has been such an eye opener for me, and I'm quite sure for my Radio 1 listener. Tremendous conversation, so much of deep insight. And fingers crossed, I'm going to use those hacks. And maybe the next time we chat, it will be after my beauty sleep.
Sounds amazing, Erica. I'm so happy to be here. Thank you for having me. And I hope your listeners benefited from our conversations.
Okay, I'm going to do just a couple of intros in case we need to patch it in. Just, hey, hello, how are you doing? Thanks so much for joining us one more time, that kind of thing. Yeah, we'll just
And
do
you
a
want me to
couple.
say,
Yeah,
thank you for
yeah.
having me.
Yeah.
Cool.
Just to give us some kind of variations in case I want to use your intros. Welcome right back. This is 94.3 Radio 1, One World, your station. You're with me, Erica, on Drive Mumbai, and I am so thrilled to welcome right back to the show Dr. Shane Creado, sleep doctor, sports psychiatrist, and author.
Hi, Erica. Thank you so much for having me. Excited to be here and share some sleep hacks with you today.
Okay. And we'll just do one more sign off. Thanks so much for being part of this and for being part of 94.3 Radio 1. Fingers crossed for a good night's sleep for all. Thank you, Doc.
Thank you, Erica. Sleep well.
Yeah, that's cool. So we're pretty much sorted. I've tried to cover as much as we possibly can. And I'm going to, sorry, I better talk into the mic. I've covered as much as I possibly can. And I'll be putting this on, I think, next week onwards. I'll chop it up into little bits and we'll do a little bit of a promo before and after. Is there anything else that you might want to add to this conversation, Shane?
I don't know where to start. There's so many things we could go into supplements, the best supplements that are helpful for people's sleep,
Okay.
like melatonin, the right kinds of doses.
Yeah.
If you'd like, I mean, talk about those supplements.
Yeah, sure. So we could do that, but I think I've got plenty to start off with, and I'm quite sure I'll have this conversation with you in the future again.
Yeah.
Okay. So let's talk about supplements or things that will assist you to sleep. Like I mentioned to you earlier, I suffer from bouts of insomnia, and I do pop like Melocet, for example, a really tiny dosage. So is that right? Is that wrong? Can you throw some light on supplements to help you get a good night's sleep?
So supplements are very helpful for sleep, Erica, if you know the right doses and the timing. So melatonin is probably the most famous supplement people are aware of, but they usually take it wrong. They take very high doses, you feel really groggy in the daytime. So melatonin is not supposed to knock you out. It's just supposed to push your brain gently into sleepiness. So it's around as effective as switching the lights off, which is why I tell people to wear sunglasses in the evening if you want your melatonin levels to rise. The right doses of melatonin, Erica, are around 1.5 to 3 milligrams 1 hour before your bedtime. That's really important. People take melatonin, lie in bed, and wonder why they're not falling asleep. 5-HTP, very helpful to produce serotonin in your brain to help you relax and sleep. And those doses may be 150 to 500 milligrams, again, around 1 hour before bedtime. GABA calms the brain down as well, between 100 to 1000 milligrams, depending on how much you need. L-theanine, 100 to 300 milligrams is great. Vitamin B6, 20 to 50 milligrams. Lemon balm extract, around 300 milligrams. Valerian root, really good for middle-aged women as well, who have hot flashes in the middle of the night. Valerian root, around 400 or 500 milligrams. Magnesium promotes deep sleep in 300 to 500 milligrams nightly. And chamomile tea are some of my favorite sleep supplements. Sleep medicines can be dangerous. They can be addictive. They can increase your risk of dementia, like Benadryl, increase restless leg syndrome. So be very careful with sleep medicines.
Right.
But sleep supplements are good.
Okay. That's awesome. We've got whatever we needed for the moment, at least. Thank you, doctor. Thanks so much.